I think readers need to understand that these studies are often initial research, that they are often reported in very alarmist and scary ways. For example, what's being picked up is how much care these kids need and how much it costs, when in fact there are lots of research that says if you allow these moms to hold their babies and have skin-to-skin contact, the amount of care they need sometimes disappears altogether. So this rush to label these moms and talk about their babies as if they all need this kind of care simply isn't true. The research on this makes clear that we know how to treat children who are born prenatally exposed to opiates. We can reduce the need for that care by being good to the moms and letting them hold their babies. And this is not a cause for panic. The study also doesn't really distinguish between women who are prescribed opiates, taking them as they are told to, and really acknowledge that suddenly stopping that, taking those opiates, could do far more harm. My concern, too, is the study looks at how doctors coded under this thing called an ICD. And that's a coding form that's used for billing purposes. And one of the questions I have, and they say there's this big increase, is are they actually coding for children who have neonatal abstinence syndrome, or are they coding for babies whose moms or the babies tested positive for a drug? That's not the same thing as actually needing care. So it's very important not to lump everybody together and rush to these really frightening conclusions about costs and need for care when we may have a real problem. There may be more doctors prescribing opiates to women. This may not be a good practice. But we know that these kids can be healthy, we know that there is treatment, and we know that respecting the moms and babies and letting them have contact with each other is the best thing we can do to reduce the costs of care.